Now, MPs are warning that the UK is at risk of losing its position as a global leader in vaccinations. The Parliamentary Health Committee says it's particularly concerned about the growing number of children who aren't getting jabs. Well, joining me now is the chair of the Joint Committee on Vaccination and Immunisation, Professor Sir Andrew Pollard. A very good morning to you. Thanks for talking to us. So MPs are saying that the UK risks losing its position as a global leader on vaccination as uptake rates for life-saving jabs has declined. How concerned are you?
Well, I think this is a very important report. It's a wake-up call for all of us that it's not time to be complacent about the threat that these many diseases cause, that today we're just holding at bay by our immunisation programme. If we don't vaccinate our children against those diseases, they do come back. And many of these are killers. They're diseases which will result in children dying. And I think the recent modelling report from the UK Health Security Agency, which is referenced in some of these documents, indicating that today London is at a critical point where a measles outbreak is very likely to happen with tens of thousands of cases. And if you have that number of cases, children will die as a result of an outbreak like that. And that, to me, is an incredibly chilling moment. We have a programme which is able to stop deadly diseases, and yet we are on the brink of another of those outbreaks happening. Only last year, we saw transmission of poliovirus in London in sewage samples. We didn't have any cases, but that also was because of under-vaccination in the capital. Now, clearly that is not just a London problem, but that's where the lowest rates of immunisation are and where we're most likely to see the first outbreaks of some of these diseases.
Why is it happening? Why are children not getting vaccinations at the same rate as in the past?
Well, I mean, we still do have quite good overall rates of vaccination, and we have very innovative vaccine policy and implementation of that policy. But when you look in individual communities, the particular arrangements to make sure that families are easily able to access vaccination is not always there. So, for example, I just to paint a scenario, imagine you're a single parent, maybe with five young children, and with those five young children, there's a baby clinic for vaccinations on a Tuesday afternoon. It is incredibly difficult to get several miles away with five young children for the new baby to be vaccinated. And I think that just highlights the difficulties that families face in accessing vaccination. There are many other reasons why we need to look in individual communities about how to improve the ability for parents to be able to get their children vaccinated.
So what would you like to see happen?
Well, I think this needs both a strategy nationally to make sure that immunisation generally is services are enhanced so that for everyone there's greater access. But in the end, you need to look into individual communities, particularly in very mobile populations like in London, to work out what the solutions are locally. Working with the local authorities, with the local NHS, who really know what the issues are. And then we need investment to make sure that access is then provided.
The report also sounds the alarm over the decline in clinical trial activity. They say it's alarming to hear that industrial clinical trial activity is at its lowest point to date. Are you worried about that, and why is that happening?
Well, I think that's a very complex picture at the moment. We have actually quite remarkable clinical trials capabilities in the UK with a national infrastructure for that. And of course, that's one of the reasons why during the pandemic, the UK really led the way in Europe in enrolment into clinical trials. Here in Oxford, the development of the Oxford-AstraZeneca vaccine involved clinical trials across the NHS involving more than 10,000 people. So the UK outperformed the size of the nation in trials during the pandemic. But really, since the pandemic, what we've seen is some real challenges in being able to move things forward with some of the bureaucracy, changes in staffing in agencies like the MHRA, which really I think needs to recover in the post-pandemic period to get us back to our global leadership position with clinical trials. There are a lot of vaccine trials going on, but I think this is more of a broader issue across the board of clinical trials. We have the capabilities, but we are just suffering some post-pandemic issues of staffing particularly.
Well, Sir Andrew Pollard, we really appreciate your time this morning. Thank you very much indeed for joining us here on Sky News Breakfast. Thank you.